Ladies and gentlemen, we will reserve the questions till the end of the session because of the restrictions of time. Now let me invite Shaluni Tissera to continue the rest of the presentation, how the nursing process looks now and how it will look in the future. Shaluni is the president of IIHS Scientific Committee, and she is also the newly appointed country representative for nursing informatics for Sri Lanka for the IMIA nursing informatics special interest group. To identify all the numbers and to identify service deficiencies and to implement corrective action.
Good morning, everyone. I'm Shaluni Tissera. It's a great privilege for me to be the media presenter after Mrs. Jayawardena, whom I mentor. She has created thousands of nurses in Sri Lanka. And now I'm going to talk about the nursing process, the present and the future. Let me start by introducing the e-health components where nursing informatics fall into the picture. Broadly speaking, electronic health is introducing computer technology into healthcare. So this can be in the hospital setting or it can be outside the hospital. It may be the public health care, primary care, and newly introduced disciplines like telehealth, IMIA, and IT, use of IT for learning, and also use of having individualized personal health records for each individual patient. So mind you, this is not proportionate because I want to go to the hospital setting and show you different information systems that are available in the hospital. May it be administration, radiology, laboratory, kitchen, pharmacy, record stores, supplies, administration and discharge, account systems and queue management systems. But in the hospital, the main e-health component is the electronic medical records. Electronic medical records is just like the bedhead ticket that we use in a hospital setting, but in a computerized version. The clinical informatics are a discipline that plays a bigger role in the electronic medical records. As we all nurses have a different part in the BHT for our own records, electronic medical records also have a specific part for nurses called the nursing informatics. Moving on, let me tell you what is nursing informatics is. Very broadly speaking, it is an overlap between the nursing science, computer science, and information science. This is taken from the American Association of Colleges of Nursing, which is one of the greatest, world's most leading bodies that work on nursing informatics. So Mrs. Jayawardena talked about the history of nursing process, and let me talk about the history of nursing informatics. In 1980s, where roughly computers came into the picture all over the world, nurses have talked about standardizing the nursing care plans with the use of computers. In 90s, the process of automating a care plan system came into play in the United Nations with the goal of reducing the amount of clinician time spent on care plan production. So with these ideas of standardizing nursing care came into it a standard set of nomenclatures for some parts of the nursing care plan, very particularly for the nursing diagnosis. So this is the very popular concept of Nanda, as we all have heard about. Nanda came into operation in 1980s. So prior to 2002, Nanda was the acronym that has been used for North American Nursing Diagnosis Association. but it is no longer the name of the organization or the acronym that we use, because after 2002, Nanda became international, and because of the significant growth of the membership outside North America. So Nanda is now, it's not the acronym, but it's the trade name we use for the set of diagnosis. So Madam Jayawardena explained about the nursing process. So I'm very sorry the terms are not visible here, but the yellow box will be the assessment, followed by the light green diagnosis, planning, implementation, and evaluation. So those things, those will be the so-called nursing care plan or the nursing process. So these will be the components of the nursing informatics. So as we all know, Nanda is corresponding to the nursing diagnosis, and then comes another set of nomenclatures called nursing outcomes classification, which we called as NOC, which is coming under the planning or the expected outcomes of the patient. So nursing outcomes has a set of standardized outcome lists under the planning part of the nursing care. Then comes another nursing nomenclature classification, which is known as nursing interventions classification, NIC, which is coming under, which corresponds to the nursing implementation or nursing interventions. So as we all know, these the different parts of the nursing care plan are interrelated with each other, same as that three components of nursing informatics are also linked with each other. So this is again what I explained to you in the earlier slide. Nanda, NIC and NOC are very comprehensive. Mind you, it is thoroughly research-based, standardized classifications, which is based on nursing diagnosis, intervention, and nursing sensitive patient outcomes. Nanda I, NIC and NOC are recognized by, initially it was recognized by the American Nurses Association, now the whole world. And also these systems are recognized by the world's largest medical literature search engines like NLM and CINAHL, and also they are mapped into they are recognized and accredited by two main health informatics standards, SNOMED, which stands for the Systemized Nomenclature of Medicine. So SNOMED is a system which contains standardized medical terminologies. So it is something like if we all use a set of names for certain clinical conditions, and if the information systems that we use are using the same, those information systems can communicate with each other very clearly. And for the same purpose, we use another system called Health Level 7 or HL7, which is that is where the e-health engineers use this system as a blueprint in producing new information systems for health. So whatever the standards the world is using now, Nanda, NIC and NOC are falling into these standards. So this will be the famous logo that you will see as the 3 N's put forward by the American Nurses Association. And Nanda, as we all know, talks about 235 diagnoses, 54 nursing interventions, and nursing outcomes classification talks about 490 nursing outcomes. And all these all these terminologies are used in varieties of specialty as the diagnosis, outcomes, and interventions, but in a computerized way. So in here what you can see is if we give a particular diagnosis, the system will give you the relevant outcomes for the nurse to select and make the care plan. And this is what, if we select the diagnosis, also the system will give a set of interventions for the nurse to select and finally come into the care plan. So, ladies and gentlemen, what is the advantage of using such a system in a hospital? Today, the nursing process is not accounted. What I mean by that is, if the nursing care plan is automated, it enables clinical judgment through the use of standardized definitions for all terms, and it would also enable the staff to identify patient needs and staff requirements for safe care, and also to evaluate the cost-effectiveness of nursing care, and to compare nursing care requirements across facilities and departments of the same hospital, and to analyze clinical reasoning and judgment practices followed by the students as well as the staff, and also to conduct research to test the effect of nursing interventions, outcomes, and patient problems when it comes to nursing care. Therefore, ladies and gentlemen, nursing informatics should be there to generate data. This data should be used to produce information. This is why we need nursing informatics to have evidence-based decision-making in nursing process. So I was fortunate to participate in the world's largest nursing informatics conference earlier this year. This is me at the Nanda International Store, and this is me with Dr. Dan J. Skiba, who's the chairperson of International Medical Informatics Association Special Interest Group, and this is the CEO of International Council of Nurses, Dr. Francis Hughes. To conclude with my presentation, us at IIHS, through our educational platform BioInquirer, are trying to educate people on nursing informatics by doing various collaborations, by introducing various educational programs, and organizing conferences like this. So hope you got a brief idea on the history and the present of nursing informatics. Thank you for listening.